So, hi, my name is Midori. I'm going to be being athletic therapist with you today. So, I read over your file very quickly, and so I see that you're suffering from hip osteoarthritis. I think it would be important for us to just go over a few points and just to explain what hip osteoarthritis is. So just to explain to you quickly the anatomy of your hip joint. So the hip joint is basically composed of two bones. So the femur bone, which is the thigh bone, and your pelvic bone. So you have the ilium, ischium, and pelvic bone that creates the acetabulum, which is the little socket that the femur inserts into. And this whole joint would be called the ball and socket joint. Ball being the head of the femur, and the socket being the socket formed by the three bones of the pelvic bone. This whole joint, the ball and socket joint, allows for multiple planes of movement as it's able to glide and rotate within the joint, which helps us basically do any motion of the hip. So when we're walking, we're extending and flexing our leg, and rotation, etc. The femur bone, so the head of the femur, is covered in what we call cartilage, which is flexible connective tissue that basically acts like a shock absorber. It's like a cushion for our bone, and it prevents bone on bone shock. The joint itself also has synovial fluid, and we also have a bunch of ligaments and muscles that are there to stabilize the joint. And it's a very hard joint to dislocate if we compare it to the shoulder. So it's a very solid joint usually. What happens with hip osteoarthritis though is that the cartilage that covers the joint, the bones, starts to to fray away with time. So if I show you this image, here you go. So you can see here that you can see the cartilage that kind of is chipping away. You can even see it in the acetabulum. And that exposes bone, which creates bone on bone friction and shock. And that leads to pain and inflammation in the joint. In later stages of osteoarthritis, of hip osteoarthritis, it's common to see also bone spurs formation, which is basically the bone that's trying to reform itself and creates little bumps. So you can only imagine how painful that is if not only you're having bone on bone friction due to the loss of cartilage, but also there's bumps in the bone, so it really grinds against each other, creating a lot of pain. So in a nutshell, that's what hip osteoarthritis is. There's multiple causes to hip osteoarthritis. There could be just naturally with age, our cartilage tends to chip away naturally due to the years and years of stress that we apply on our hip joint. There's also anatomically, if ever we're born with, some people are born with a slightly off angle of the head of the femur, which creates pressure points or points where the cartilage kind of rests on each other, which accelerates the chipping away of the cartilage due to increased friction where it's not supposed to be rubbing against each other. That can also be seen in hip dysplasia, where the bone just anatomically it doesn't go well together. In the same thought, if you're overweight, it adds additional strain to your joints, not only your hip joint, but your knee joint, your ankle joint. Just that extra pressure and weight on your body can accelerate the degeneration of the cartilage that's supposed to be there to protect our bones and prevent the bone on bone grinding. And there's also genetics. If someone in your family, like a parent, a close parent, or a close relative suffers from hip osteoarthritis, that may be an indication that you might suffer from it in your later years. There's also, if you have a sport-related injury, that can also happen in younger athletes. So there's multiple reasons why someone could suffer from hip osteoarthritis. In your case, I think it would be strongly correlated to age. And I also read over your complaints. So it says that you have pain when you're walking with an obvious limb. We have a little bit of a decreased strength at the hip, but also at the knee joint. You're unable to squat down to the chair without using your arms, and we have limited balance. So for the walking, I think mainly it would be the pain that's preventing you from having a normal gait and being able to walk freely. When you go into flexion of the hip, that creates additional bone and bone friction, which increases pain. And in general, I think since you're experiencing a lot of pain right now, you might have not been as active in the past weeks, and that can affect your muscle strength. So muscles are really important for the stability of the whole joint, or of any joint basically, but the deep hip muscles, so you have, your glutes, you have all these muscles that are supposed to stabilize the hip joint that are going to be weak if you don't use them. So for example, just a quick example, if you think of your quad muscles, they cross the rectus femoris, more specifically, crosses your knee joint. It attaches into your patellar tendon, but it originates in your hip. So it crosses two joints. It helps with your knee flexion, but also your hip flexion. And so, for example, when you're squatting down, you need to have some type of strength in your quads to be able to sit yourself down. And if you don't use these muscles as frequently as you used to, there could be a decrease in the strength, which could lead to you having issues with sitting down. Same as balance, so your one single leg balance is very limited, and I think that's just due to the fact that there's a lack of strength in your stabilizers, so your core, in your hip as well. And as I said, the pain that you're experiencing is really a direct result from the fact that the cartilage is chipping away in the hip joint, which creates bone and bone grinding and pain. There could also be some swelling or inflammation that really restricts your range of motion. So following all these assessment findings, I think for now our plan would be to try and strengthen the muscles of your hip. It's important to help your joint as much as possible and try to alleviate any excessive tension, pressure that could be applied to the joint. And by stabilizing and strengthening those muscles, it's going to alleviate your symptoms of pain and help you regain a little bit of the range of motion that we lost. And we could also try to improve your balance with some balance exercises to decrease the risk of you falling at home. All of these symptoms that you're experiencing obviously have a direct impact on your independence at home, and so we want to try to get you to a point where walking is not going to be an issue, but sitting yourself down and your balance won't be a risk factor to your general health. We want to decrease the risk of you falling at home. Definitely strengthening the muscles of the hip just to add support to the joint, try to alleviate the pressure that we're applying at the joint, and to help you with the ranges of motion and gain what you lost. And also, if at some stage with hip osteoarthritis, sometimes doctors would recommend to get hip surgery, so total hip replacement. And if ever we get to that point, having a strong and healthy body and strong, healthy muscles definitely helps with the recovery from surgery. So there's really no negative to getting you active, getting you moving. Obviously, by respecting your pain and not crossing the limits of pain, but just working with the pain and strengthening the muscles to give extra stability and help to the joint.